Small drug makers supplying medicines in rural areas under scrutiny. Center calls for crackdown small pharmaceutical companies, especially those supplying medicines in rural areas, have come under regulatory scrutiny, with the Drug Controller General of India DCGI directing state officials to closely monitor their activities and ensure accountability. The DCGI has asked states, via state licensing authorities SLAs, to take strict action against any such marketers found violating quality standards under the Drugs and Cosmetics Rules, 1945. The move comes amid growing concerns over the quality and compliance practices of certain small-scale players in the drug distribution chain. The Apex Drug Regulatory Agency has also called for stricter action against the repeated manufacture of spurious and not of standard quality NSQ drugs and asked states to keep SCO informed of any regulatory actions taken. We are still awaiting response on Schedule M compliance, and most small players are unable to cope up with quality scrutiny. The government is convinced that without proper oversight, these companies pose a risk to medicine safety in underserved regions, a senior government official privy to the development told News 18. The official added that the Apex Regulatory Authority, Central Drugs Standard Control Organization (SCO), has conducted over 1,000 risk-based inspections (RBIs) across the country. These inspections have been key in identifying non-compliance among drug manufacturers and strengthening the surveillance framework. Despite this progress, multiple regulatory challenges remain, and the Central Drugs Standard Control Organization (SCO) has asked states and UTs to prioritize urgent reforms. The first is adoption of revised Schedule M. The DCGI has asked state officials to begin enforcing updated good manufacturing practice norms for drug production units. Also, it has asked to fix new drug licensing gaps, as state licensing officials have been asked to refrain from issuing product licenses without proper permissions from DCGI. The officials have also been instructed post-risk-based inspections action. The states and UTs have been urged to act on the findings and recommendations that emerge from inspections. Swipe left for next video. CDSCO has informed officials to comply with 84AB, in which details of all drug makers and product details must be uploaded and verified on the central online portal to ensure traceability. Also, the state officials will work on building testing lab capacity, which has been flagged as a critical need. Latest blogs.